As you're aware, on the Wheel of Wounds segment, we tried to find talent to spin this wheel. As you all are aware, the state of Wisconsin has been a political hotbed for well over a year, and the translation to the presidential race has been no different. Both candidates have been in Wisconsin frequently, and I just happened to run into one of them in the hall today, and I asked him to join us on the Wheel of Wounds. Governor Romney, welcome to the Wound Wire.
Well, thank you, Dr. Niezgoda. Pleasure to be here. Pleasure to be here. And I just want to say I've been so impressed with the show that if I'm elected next week, I want to make this promise to you, Dr. Niezgoda. I want you to be my next Surgeon General.
Oh, my goodness. Surgeon General, Governor, President Romney, that would be fabulous. So tell me, do you enjoy the Wound Wire?
Oh, I certainly, I get a great kick out of it. I watch it in my spare time. I've seen every episode.
Would it be too presumptuous to say the Wound Wire is the best internet-based wound care program that exists?
Oh, I would go even beyond that and say it's the best there ever will be.
Well, Governor, are you ready to spin?
I sure am.
All right, give that wheel a big spin. This will tell us what wound we're going to be talking about. And around the wheel goes. We never know on what wound it's going to stop, but it appears to be slowing ever so slightly. And look at that, Governor. You picked a venous leg ulcer.
Oh, that's fantastic. It's my favorite kind of wound.
Well, listen, thank you so much for joining us on the Wound Wire, and good luck to you in your campaign next week.
Well, thank you, and we look forward to your vote.
Let's talk about venous leg ulcers and venous insufficiency. We'd like to thank Governor Romney for selecting venous ulcerations as a topic of today's presentation. Let's spend some time talking about venous disease and venous insufficiency ulcers. It affects a lot of folks. By some estimates, 2 to 5% of the U.S. population. Many of these individuals will have some form of venous disease or venous insufficiency. 1 million ulcers related to venous disease affecting the U.S. population. And when patients are lucky enough to heal their ulcers, 72% of them will come back with a recurrence at 1 year. The costs of treating this form of disease is astronomical. By some estimates, up to $2.5 billion. And the cost of treating an individual patient with a venous leg ulcers can be as much as $40,000. And these statistics are relatively recent, published in 2009. In understanding venous insufficiency and venous leg ulcer disease, you need to understand first the anatomy. Here's a schematic showing the major veins that are involved. There is a deep venous system, a superficial system, and then a communication system between the two. You also need to understand, in addition to the anatomy, you need to understand the function of the venous system. As we know, the superficial system communicates with the deep, and we take flow from superficial to deep up back to the return of the heart. And this is largely enhanced by compression of the leg muscles. Now, very important this function is for the valves to function properly. When you have venous valves that are functioning properly, they open with flow back to the heart and then close again to prevent the blood from going back distally and pooling in the leg. However, when those valves are injured or damaged, there is a problem leading to venous disease. What can cause damage to the veins in the legs? Many things. Immobility, prolonged standing or sitting, obesity, pregnancy, smoking, forms of thrombophlebitis. Very common in a patient's history will be a history of a deep venous thrombosis. Many of these patients have had prior surgeries, whether a hip replacement surgery or some sort of intra-abdominal surgery. They're at risk for DVT, thus valvular damage. And then certain types of hypercoagulable states, such as seen in patients with cancer, can also injure these gentle veins. And when these veins are injured, they no longer work as normal. And what happens is we start to have increasing pressure in the vessels. Because that column of venous blood is pooling, there are large increases in hydrostatic pressures. And it overcomes the osmotic tissue pressure, tissue gradients in the dermal capillaries, leading to extravasation of fluid, transidate and exudate, into the tissues. This causes problems from a patient manifesting as many forms of venous disease. But in the case of our patient that presents to the wound care clinic, a venous ulceration. We'll see that these patients present with edema, hyperpigmentation due to hemosiderin deposition, and then frank ulceration, as we talked about. When this patient does come to the clinic, it's our job to manage the patient. And we need to understand that the mainstay of treatment is going to be compression therapy. And we're going to spend some time talking about compression therapy, both in this episode as in future episodes. Don't forget that in addition to compression, we need to interrogate the venous vascular system and intervene where possible. I hope you enjoyed this very short presentation on venous disease, venous insufficiency, and venous ulceration. I hope it enhances your clinical practice.